Hi, I'm Dr. Craig Castanet. Today I'm going to talk to you about 12 benefits of chiropractic care after a car accident. And if you've watched any of my other videos, you know I usually speak extemporaneously on topics that I discuss, but this is too detail-oriented, so if you forgive me, I'm going to read through these 12 benefits that I've written out. Number one is to evaluate for injury severity. Most of the time, a car accident will not result in serious injury, including occult injuries. But it does happen sometimes, and you don't want to miss these injuries. Every chiropractor can remember surprising injuries that arose from a car accident, and the patient was not that symptomatic. So you can't depend upon pain to reveal serious injuries always. This can include fractures, dislocations, and even incidental findings like seeing cancer on a diagnostic imaging. Number two, determine if a referral to another provider is necessary. Getting examined can reveal myriad types of injuries that require referral to another medical specialist. Referrals can include diagnostic testing or treatment, such as to pain management, orthopedic surgery, neurosurgery, emergency medicine, neurology, primary care, and more. Number three, determine what diagnostic testing is necessary. Referral for these can include x-rays, CT scans, MRI scans, electromyography, nerve conduction studies, bone scans, and others. Sometimes incidental findings are found which require referral for evaluation for unrelated entities that you see after a car accident. Again, I mentioned cancer earlier, that's one such example. This can include diagnostic testing to be determined by other medical professionals or specialists that you refer a patient to. Number four reason to see a chiropractor after an auto accident is to inform patients of the nature of their injuries, determining what is wrong, what is not wrong. That's essential for patients to know as soon as possible. Framing their injuries, their severity, and prognosis is important to allaying the patient's fears and anxiety. We are treating the patient's body and we're treating their psyches also. Both are important in recovering after physical injuries. That doesn't mean false reassurance, but it does mean framing all the data in a thorough manner and reducing any needless misinformed anxiety about the prognoses of their various injuries. Number five, to provide prognosis for recovery from injuries. Patients want to know what's wrong, how bad is it? Will I fully recover? How long will that take? What can they do to help themselves recover? What should they avoid? And any other data relevant to their optimal recovery from these injuries. The doctor should address all the injuries and how each injury is expected to progress in their recovery. Also, the doctor must explain the recommended treatment, its rationale, how quickly they should expect to recover, what will be done if their progress is unsatisfactory, and what other diagnostic testing, referral, and treatment may be done if progress is unsatisfactory. Number six, provide treatment and reduce pain and inflammation from injuries. Once the diagnoses are determined, the doctor will determine a treatment program with treatments and their frequency. Reassessment of patient progress and their response to treatment is done at every visit, and treatments may be revised depending on the progress. The global purpose, of course, of treatment is to resolve the pain and restore normal functioning, and to do that as soon as possible. Realistic timeframes for this vary with the patient, their injuries, biopsychosocial factors, just about anything you can conceive of, in other words, as well as injury severity and more. Number seven, to document patient status and progress for medical legal purposes. Many patients who are injured in car accidents have legal claims against another person's insurance company. These patients typically secure an attorney for legal representation of their claims. The medical legal arena requires that doctors document all the relevant data to the patient's injuries, treatment, progress, outcome, work status, and more. And these records are then sent to the attorney at the conclusion of the patient's medical treatment, and this is the basis for the demand package which their attorney will eventually send to the insurance company to begin legal negotiations over a settlement of the case. Number eight, to restore physical functions to pre-injury status. That is the objective, and it is usually possible, though not always. Some patients end up with chronic pain from car accidents even after they have been treated by many medical specialists. In fact, many patients, especially those who are older, have pre-existing degenerative arthritis, which makes them more likely to suffer worse pain from their car accident traumas, and it can take them longer to recover from such injuries. Number 9, address work and disability status. Some patients will lose no time from work after a car accident, but this depends upon when the accident occurred, how bad are the injuries, what are their work demands, and will their employer accommodate any limited work duties. Many patients will miss a few days from work immediately after the accident and then be able to return to work. And a small number of patients will miss a protracted amount of work, and rarely, too, a patient may never be able to return to their previous employment. Work and disability issues have serious legal ramifications, of course, and must be documented thoroughly by the doctor. Number 10, document and provide information to all parties as needed. Car accidents involve many parties medically and legally, and many of these parties are entitled to the patient information if a lawsuit is filed against an insured's defendant. Relevant parties can include the patient, their family, all the doctors involved in providing care, attorneys for the patient and defendant, and more. Number 11, explain the diagnostic testing and results. Throughout the patient's treatment, and depending upon the complexity of the injuries, there may be many doctors involved in treatment and many diagnostic tests that are performed for evaluation and to guide appropriate treatment. All of these tests need to be explained to the patient's satisfaction. This includes the purpose of the testing, what the results mean, and how the tests are relevant to treatment recommendations going forward. And lastly, number 12, instruct in biomechanics and ergonomics relevant to injuries. From the first day of evaluation until a patient's treatment is concluded and even beyond, the doctor should teach the patient how to be as functional as possible without overdoing it, so to speak, and how to do their activities of daily living in the most safe and ergonomic way possible. Most patients do many things in their normal activities that are biomechanically poor, and this is less tolerable after their bodies have been injured in an auto accident. So this information is important and useful now and in the future. I'm Dr. Craig Castanet with this video topic on 12 things chiropractors can do to help after an auto accident. If I can help you, I'm in Decatur, Georgia. My website is backstrong.net. You can go from there to my YouTube channel if you'd like to see more videos on a variety of spine-related topics. I am in Decatur, Georgia. As I said, my phone number is 404-558-4015. And if I can help you with your injuries after a car accident, please let me know. Thanks so much. Bye-bye.